Hospitalizations in Southwest, Central, and South Central health districts, which includes the Treasure Valley and the Magic Valley, are reaching a critical point. Without a change in direction, crisis standards of care are imminent.
Imminent, as in about to happen. Not like maybe it could happen, but about to happen. Timing is the only question left, according to Jeppesen and other medical experts in the Treasure Valley. Could be any time, days from now or moments from now. What we know for sure, this surge hasn't let up for area hospitals. Director Jeppesen says over this past weekend, a weekend that saw a Boise State football game, art in the park, and a Pride Fest, Treasure Valley Hospital saw more than 60 new COVID patients admitted. 60. Meanwhile, 10 hospitals in Idaho's Panhandle are already operating under crisis standards of care, have been for about a week, where they're ranking patients who get care by order of chance of survival. They're converting classroom space into critical care units like they've done at Kootenai Health in Coeur d'Alene. Making more space for sick patients is one thing, but having the staff to care for them is another. Those still making it work are requiring extra shifts, something they've been doing for a better part of a year and a half. And that, as you can imagine, has caused a lot of burnout. So now hospitals are having to care for more than double the number of patients with a reduced number of nurses and doctors and staff. And no, we're told this isn't about a vaccine requirement some hospitals have issued. Those 10 hospitals up north, they don't even have such mandates.
The hospitals continue to see a tremendous amount of stress, predominantly due to staffing constraints that they're experiencing. This is ubiquitous across the state, regardless of whether or not hospitals have vaccine requirement.
Regardless, well, understaffing has been an industry-wide problem for some time, so now it's an all-hands-on-deck kind of thing. The Department of Health and Welfare is deploying both clinical and non-clinical staff to help with these shortages, and that includes those from the Defense Department, the National Guard, AmeriCorps, and the Department of Labor. They've also given out millions of dollars to help keep staff on board, among other things they've tried to do. So the hospitals and their ICU beds are filling up and staying that way. Numbers are higher than we saw during last December's peak, as you take a look at that graph. And these are only the cases that are being reported. There are more than 50 hospitals in the state of Idaho, but not all of them report their numbers to the state every day. Let's take Saturday, for example. Only 34 hospitals submitted their data. The day before, 42. So it's kind of all over the place, which explains why some days we see a drop off in numbers, then we see big jumps on other days. With that said, we saw a record number of hospitalizations last Friday, 626 people in the hospital with COVID-19. And that's even without reporting all the hospitals reporting those numbers. During December, when we thought we were in the worst we'd see when it come to COVID, well, before a vaccine that was, remember? When crisis standards of care was also on the horizon, we had our worst day at 496 people in the hospital with COVID. And sure, not all of them are in critical care condition, but all of them still need help while they're in the hospital. And according to Director Jeppesen, 91% of people currently in the hospital for COVID are unvaccinated. This graph doesn't even include the weekend numbers we mentioned, those 60, so it should be higher than that. But then again, some people do discharge from the hospital. But these new numbers won't come in for a few more minutes. How about those in critical care? Let's take a look at the ICU numbers from the last 2 months. The darker orange number you see on the right is showing where we are near the state capacity statewide. You see that big drop? That's because they started reporting those numbers differently right about July 3rd. Back on July 8th, we had about 156 ICU beds available across the state. Last Friday, on September 10th, we had just 6 beds available. These numbers are fluid and they only represent the number of staffed beds available at that moment in time. Beds consistently open back up, but then, as you also know, they quickly fill back up again. Now, a faint silver lining in all of this happened yesterday when Idaho broke the 50% barrier for vaccinations of those eligible, 12 and over. But that doesn't include the 300,000 or so of those under the age of 12.